There is increased concern about a new COVID strain spreading across the globe, the Delta variant, first detected in India. Now, health experts in the U.S. are encouraging more Americans to get vaccinated to prevent another outbreak. Mark Strassman reports.
At this South Carolina Wellness Center, patients call the shots. Which of 3 authorized COVID vaccines they want. Supply dwarfs demand in a state fighting vaccine resistance.
Wait till my friends got it first.
And why is that?
Because I wasn't sure about it. And so after gaining a little more confident about it.
In South Carolina, just 40% of people have been fully vaccinated, one of America's lowest rates. Now the Delta variant, first identified in India, has emerged as America's pandemic wildcard. Early data suggest it's more contagious and deadlier than any other known variants, and spreading quickly. The CDC estimates roughly 10% of Americans now with the virus have the Delta variant. South Carolina has 4 known cases, but the worry, a more vulnerable population than many states with higher vaccination rates.
Certainly, we could absolutely see another surge due to this Delta variant.
Dr. Brennan Traxler oversees public health for the state of South Carolina.
We have seen how rapidly this variant can spread, both in other parts of the world and the country, and so it can very quickly take hold here in South Carolina.
One sign of COVID complacency, people skipping their second shots. Protection against the Delta variant plunges, according to a British study of the Pfizer vaccine. It's almost 90% effective with 2 shots, but with 1, down to 33%. The CDC estimates 10% of Americans who received their first dose of the Pfizer or Moderna vaccines missed their second one. That's 13.5 million people. To encourage more vaccinations, South Carolina and other states have promotions like the one at this brewery. It's called A Shot and a Chaser. Get the vaccine, and the chaser is a free beer, if you're over 21. Lana?
Important disclaimer. Mark, thanks. For more on this now, I want to bring in Dr. Annalee Baker. She is an emergency medicine physician at NYU Langone Health. Dr. Baker, thanks for being here. So officials from the World Health Organization said Wednesday that the Delta variant could cause more severe symptoms. What needs to be done to determine if that's true?
Well, thank you for having me, Lana. Yes, when we look at these new variants, of which there's, actually quite a few, close to 50 that we've identified, what we're looking for is to see 3 things. First, whether it's more infectious, which we know that the Delta variant definitely is. Second, we look to see whether it is actually causing more severe disease. And thirdly, we look to see whether the virus has begun evading the ability of the vaccine to prevent its infection. So in this instance, we do have a lot of early data showing that it does appear to cause more severe disease. The data coming out of India and Britain is pretty compelling. So it looks like, unfortunately, this particular variant hits all 3 of those concerning boxes, making it even more important that we get everybody both vaccines as soon as possible.
I want to follow up also on what we heard from Mark's reporting. He said that one study found that the second shot of the Pfizer vaccine was almost 90% effective, but only 33.5% effective after 1 shot. And nonetheless, we're seeing millions of Americans only getting their first of double-dose vaccines. Why is that? And what would you say to anybody who's watching this program right now that's maybe gotten their first shot and hasn't bothered to get their second?
Well, you're absolutely right. We are seeing that, and it's very unfortunate. I think there are a couple of reasons. Early on, there were several prominent scientists, very intelligent and experienced scientists, who were advocating for actually even intentionally delaying the second shot in order to get as many people the first shot as soon as possible. And that was not an unreasonable strategy. There was quite a bit of argument in the scientific community about whether that was the correct strategy or whether we should push for full vaccination, even if that meant fewer people getting their first shot at an early date. I think we've seen in the UK that strategy that they did pursue in terms of spreading those doses as wide as possible, but delaying the second dose for some people is really coming back to bite them, as we see the Delta virus taking precedence. There in the UK, it's about 90% of the strains now are Delta. And here in the US, we're always a few weeks behind the UK. So what we're trying to avoid is going from what we're at right now, which is around 6 to 10%, up to that number that the UK is seeing, in which case we will see another surge, certainly in places with low vaccination rates.
Experts have also expressed concern about these variants spreading to vulnerable communities, ultimately causing another widespread COVID outbreak. Help us understand which communities are at the highest risk for the Delta variant, and remind us, does this pose a risk to people who have been fully vaccinated?
Absolutely. So the first communities that are at risk are certainly the places where we're seeing low vaccination rates overall, places in the Deep South, Mississippi, Alabama, places where far less than half, and in some cases even a quarter of adults have been vaccinated. So those communities are certainly at risk for a surge. But we have to remember that the vaccine is not fully effective for all humans equally. People who are living with autoimmune conditions, or people with cancer, people with HIV, there's so many millions of Americans who are immune compromised who may get the full vaccine series but not form an adequate antibody response. So that's why it's even more imperative for those of us who can get vaccinated and can form a robust immune response to do our part and be vaccinated, because the all-important herd immunity that we've been talking about for a year and a half now is something that is just out of reach, because not only can we not get everybody vaccinated, we've got a certain number of people who will be vaccinated and still be unprotected.
Yeah, the very idea of herd immunity is that for those of us who can become vaccinated, to do so to protect people who cannot, or in the case of some people with immune responses that are insufficient, that even if they get vaccinated are unable to be fully protected. One last thing for you, Dr. Baker, before I let you go. On Thursday, the Department of Health and Human Services announced that they are investing more than $3 billion into new antiviral COVID-19 pills. I'm wondering what more you can tell us about this development.
I was very encouraged to see that investment. The vaccine is still by far the most effective way to prevent the virus transmission and also to decrease the severity of disease. But again, as we said, there will be people who will be immune compromised, unable to avoid infection, and particularly in those cases, and also in cases where, remember, all the vaccines, they're remarkably effective, but they're still only in the 90% range. So there will be people who still get infected. And it's important that we focus on therapeutics as well. We've got several spectacular vaccines, and the primary concern with vaccines now is facing vaccine hesitancy and distributing across the world with a focus on equity. But in terms of developing therapeutics, the first focus initially was trying to repurpose older drugs, which was a reasonable strategy. We do that all the time with viral illnesses. But in this case, they're really focusing on a number of drugs that have shown some promise, and even in new drug development, which I think is very encouraging, because we need to be ready for the possibility that this pandemic is going to taper off but not fully go away for some time to come.
Yeah. All right, Dr. Annalee Baker, thank you for joining us, and thank you for all that you do.
Thank you for having me, Lana.